The ION robotic navigational bronchoscopy system is a new way of doing bronchoscopy that allows us to get biopsies of patients' lung nodules and suspicious lesions at a much earlier stage than what we have been able to before. The robotic aspect allows us to be much more precise in the way that we obtain biopsies in areas of the lung that we're able to get to, as well as minimizing side effects from the biopsies. Previous to having the ION robotic navigational bronchoscopy system, a lot of times we would have to do biopsies with CT-guided biopsies or a transthoracic needle aspiration. One of the drawbacks of that procedure is that there's a relatively high risk of pneumothorax as compared to doing it with the ionic robotic system. The ION robotic navigational system is a quantum leap forward in the technology that we use to be able to diagnose patients with lung cancer at a much earlier stage that leads to less complications and allows us to have a full continuum of care from screening to early diagnosis to advanced modalities of treatment, whether it be surgical or radiation oncology.
As a pulmonologist, we want to be able to get a diagnosis of patients' lung cancers quickly and with the least risk possible. With this new type of device, with this new system, we're able to make a diagnosis very quickly and at a lot lower risk than we had been able to in the past. As a pulmonologist, I want to make sure that we get an accurate diagnosis with the least risk to the patient and be able to get a diagnosis and a stage of the lung cancer quickly so that we can get treatment going quickly for the patients. The faster we can get a diagnosis and the faster that we can get a stage of the lung cancer, the faster that we're able to get treatment going and the better the outcomes for the patients. Here at MercyOne in Des Moines, over the last 10 years, we've dedicated ourselves to improving the outcomes of patients with lung cancer. We have one of the largest lung cancer screening programs in the state. We had one of the first incidental pulmonary nodule programs in the state, and now we have one of the first multidisciplinary lung cancer clinics in the state. MercyOne is dedicated to improving the outcomes and improving the quality of life of patients who have lung cancer. The ION robotic bronchoscope fits perfectly into our whole model of individualizing treatment for patients, to get treatment and to get a diagnosis done quickly and safely, and that's where the ION bronchoscope fits perfectly into our whole system here. The ION robotic bronchoscope is the only device like this in the state of Iowa. It's one of the few in the Midwest, and it fits perfectly into our entire model of individualizing treatments for patients with lung cancer, getting a diagnosis done quickly, to get treatments done quickly, and to be able to individualize treatments for patients and their families.